Okay, so we're going to talk this evening about lifestyle changes for disease prevention, lifestyle habits, things that we can do for preventative healthcare. So we've always thought of healthcare as being treatment. Healthcare is a lot more than treatment. The best kind of healthcare is prevention. Treatments happen when you've already got sick. But if you want, the best way to take care of that is prevention rather than cure. So here I have a question, which do you think is better? And we already have prevent checked off. It's better, it's easier to prevent stuff happening. And you're just looking at some small modifications to lifestyle. Some people are living a healthy lifestyle, others just need some tweaks. And it's not difficult. When you begin to feel better, it becomes easier. One of the things that's a priority in preventative care is to have a primary care physician. You don't need, there was always the thinking of you go to the doctor when you're sick. You go to the doctor whether you're sick or not. You get primary care prevention is one of the areas that primary care doctors, adult internal medicine doctors, and family practice doctors are all trained and specialized in preventative healthcare. It's coming more to the forefront now than it was in the past. In the past, say 40 years ago, people had insurance. They might go to the doctor when they're sick and the treatments would be covered. Now we're getting into a situation where not everything is covered by the insurance company and you can have huge out-of-pocket expenses. Since the Affordable Care Act, you're able to switch jobs and not be penalized for having a pre-existing condition. So if prior to the Affordable Care Act, if I was working somewhere and I had my health insurance and I developed high blood pressure, and let's say I was on medication, when I would transfer to another job, maybe get another insurance company, that high blood pressure would not be covered by that insurance company. So I would have to pay out of pocket for all of the medications, the doctor's visits, all relating to the high blood pressure. That thankfully is not the case now. But what's most important is periodic health maintenance visits. So you're healthy and you want to stay healthy. This probably is more to younger people who are healthy and you want to stay healthy. Not every 30-year-old has a primary care doctor, and it's a mistake. If you're working and you have some kind of insurance coverage, even if you don't have insurance coverage, you can get a primary care doctor to take care of you. A yearly physical, there's nothing wrong with you. There's no reason to think there's going to be anything wrong with you, but you have established a baseline and you've established a lot of times a doctor doesn't want to see a patient for the first time when they're sick. They may send them to a walk-in care or an emergency room. You're waiting there. It's one doctor. You see the doctor. They don't know anything about you. They know nothing. If you have a primary care doctor, you can go to them when you're sick, but you need to establish the relationship with the primary care doctor when you're well. So you should, if you're 49 or less than, up to 49 years of age, you could probably see your primary care doctor every 3 years. A visit for a physical every 3 years. Obviously, if you get sick in between those times, yes, of course you can go. But we're talking right now about health maintenance. And every year, if you're 50 years or over. Go to the primary care doctor, go to your family practice doctor, go to your internal medicine doctor. You don't have to be going to see specialists. So that's for adults that are 50 years and over every year. There's 4 major types of prevention that we're going to look at: immunizations, screening, lifestyle changes, or that's sometimes called modifications, and drugs to prevent disease. So immunizations, we'll talk about that later in the presentation. Immunizations are those vaccinations that you get against diseases. We had the polio vaccine that a lot of people, there's another pneumonia one that everybody 65 and over should be getting. We see the flu vaccination or the flu shot to try to prevent us getting flu. And it's a form of immunization. We already have a certain amount of immunity built up in our bodies anyway. And immunity happens when you get an infection and it's all busy inside in your bloodstream. And the bloodstream is saying, oh my God, look at this foreign body coming in here. We better start developing antibodies to this. We better get this under control so that the next time it ever happens, it's not going to affect the person. So you might get sick the first time, but then if it happens again, I've often heard people say, oh, I never get colds, or I don't get, my colds only last for a day or two, because you've developed, your body has developed a certain immunity to it. Some flu viruses we don't develop immunity to. The virus itself changes. We hear influenza A, B, H1N1, all kinds of flu viruses. And that's where the immunizations help. Immunizations, and it's not always a live vaccine, like a live organism that's injected, but they inject something, your body chases around again, develops antibodies, and then that's it, you're protected. So that for the next time it's happening, you're going to have those antibodies from the vaccination, like the COVID vaccine. The COVID vaccine was new. Yes, it was developed very quickly. And I know a lot of people had concerns about how quick it was developed, but they had to develop it quickly. People were dying. When people aren't dying from something, they're more inclined to, they go through other procedures with the FDA to get something approved. The COVID vaccine from Moderna and Pfizer was an emergency use vaccine. Emergency use is people are dying, we need to get this sorted out, we need to get this vaccine together. They developed the vaccine, and make no mistake, the FDA scrutinized every piece of paperwork that goes in about that vaccine, and they would have handed it all into the FDA. They looked through it, yes, that's fine, you can use this vaccine. I think I mentioned this in another talk. AstraZeneca was a vaccine that they had in Europe. And there was a time here in the United States where they were saying that if people coming into the country from Europe, if they had the AstraZeneca vaccine, they were not recognizing it as a vaccine. Now, it's not that it wasn't a vaccine, it was just as much of a vaccine as what we had here. The difference was that AstraZeneca never applied for emergency use in the United States. And because of that, the FDA didn't have any paperwork relating to AstraZeneca, and they couldn't say, yes, it's a good vaccine, or no, it's not a good vaccine. They never got any documentation. And that's why it wasn't recognized as a vaccine, because the purpose of all of this was to protect the public. Anyway, screening. The other screenings, we see all the cancer screenings for various things. People are getting colonoscopies, pap smears. There's all kinds of screening. I'm not going to go into the different types of screening. I will be doing another talk later, I think in October, which will be relating to screening and early detection of cancer. Lifestyle changes. You see, we have a bottle of wine here. You can have a glass of wine, you can have alcohol, just don't go over 7 drinks a week. Some people binge drink, some people drink too much, some people abuse it, and some people are alcoholics. And they will check for that. So, you know, that's part of the prevention. If you need to have behavioral counseling or anything, you know, stop smoking, all of that, you can get those, that kind of counseling. Regular health screenings, we talked about the screenings. Smoking, when you go to your doctor, you will be asked about your smoking habits. And it's not that they're not there to accuse you or to blame you for anything. They're there to get you to the resources that will help you. That will help you to stop smoking. If you drink too much, get you to the resources that will help you stop drinking. And then we have drugs to prevent disease. So we have things like people that have high cholesterol might be on a medication that will prevent other diseases happening from high cholesterol. So they will take medication. The primary care doctor might give you medication to bring your cholesterol down. So, and it could be a lifetime medication to bring down your cholesterol so that you don't run into other problems that a high cholesterol can cause. And that's a form of prevention. There's primary prevention, which keeps diseases from occurring. And how that happens is it removes the cause. Immunizations prevent communicable diseases, those public diseases that are spread in the community. One of the ones that comes to mind is the community-acquired pneumonia. And there is a pneumonia vaccine that's recommended for people of 65 years and older. Prophylactic surgery, somebody is obese and they are not able to diet, you can have bariatric surgery so that it will help you reduce weight. And that's, they kind of tie off the top. I'm not a surgeon, I don't know what they actually do per se, but I know they kind of make the stomach smaller so that you're full faster. Mental health, do not forget about your mental health. Do not forget about preventative mental health. Coping strategies, behavioral strategies, stress, anxiety, depression, all of those things come under the heading of mental health. We're all stressed for various reasons at various times throughout our entire life. I'm talking about prevention, having a primary care doctor. If you feel you need to go into therapy or you need counseling, we talk about our physical health all the time, yet we never, rarely, if at all, take care of our emotional health. You want to maintain emotional health throughout your entire life. People have lost family members, they have lost children, they're grieving, all of that you can get through your primary care doctor. If you need more coping strategies or you need help with your emotional health, please reach out to your primary care doctor and they will get you the help and the counseling that you need. It may be long-term, it may not be long-term. You may not need it, you may only need a few sessions. Whatever you need, but don't overlook and just think of your physical body. You have a mind and a mental health as well. And there's no reason, even if you're healthy and you're just under a little bit of stress, any doctor understands that and they will get you the resources and the help that you need. Behavioral changes and counseling, we're talking about smoking cessation. If you smoke and you want to quit, well, you should be quitting, but you want to quit, but you can't. There's smoking cessation programs, there's community health programs, there's public health programs that are all free to help people stop smoking, help people stop drinking. We have the AA, but there are other organizations and other tools that a primary care doctor can help you get those resources. They know where those resources are. Primary prevention, we see we're using seatbelts in a cars. It's the law now. Seatbelts are a primary prevention, so that if you are in a car accident, there's less chance of you dying from a car accident. Helmets for bicycles, child car seats. Children of a certain age, up to a certain age, have to be in a child car seat because so they're not, the prevention of injury is all part of preventative health care. Secondary prevention. And this is where you can detect early disease when it's asymptomatic, so you've no signs and symptoms of a disease. You don't have anything that indicates that you're sick, but maybe on an X-ray or on a scan or in a blood test, it might be highlighted and say, oh, your sugar is a bit high or your cholesterol is climbing up a little bit. That's something we need to watch. And that's secondary kind of prevention. So if your sugar is climbing up a little bit, you don't want to end up as a diabetic. You can receive counseling on that. Education around your diet. And here, this is where your cholesterol will come in as well, where treatment can stop it progressing into something that's far worse. Treatment like medication treatment. I have screenings written here. The PSA blood test for prostate cancer. You see here, there's HbA1c, that's a diabetic test. It's a fasting blood test. The cholesterol is a fasting blood test. You go to the lab, the doctor puts in an order, almost everything is in the computer. You go to the lab, they take your labs, everything is normal. That's great. Now you have a baseline. Now you know that in 2022, but September of 22, I had labs drawn and everything was normal. So if in September of 2023, you have labs drawn, and there's slight changes, you know how long those changes were there. They were not there for any longer than a year. The baseline has been established. We have pap smear tests for cervical cancer. Pap smears are done on all women should be having pap smears done. You may get a report back that might say it's normal, nothing there. You might get a report back that says there might be some atypical cells there. It doesn't mean that they're cancer. It doesn't mean anything other than they're not the normal shape. So you watch it. The next year you have another smear test and you know if they know if this changes. So, okay, you had it this year, it was normal. Next year there was atypical cells there. You have a baseline, you know how long they were there. If you're not going to a primary care doctor and you don't, some people do go to the gynecologist for pap smears. You don't always, family practice can do pap smears, or you can find family or women's clinics. Sometimes it's the nurse practitioner that's working there and they can do the pap smear. So your preventative care is all involved in establishing a baseline so that if anything shows up later, you know how long it's been there. Instead of having a pap smear done, first time you're at the doctor, you're 35 years of age and they see atypical cells. They don't know when those cells came there. Were they there 5 years? Were they there 10 years? Mm-hmm. So it's important for everybody to have a primary care doctor and look at prevention. Then there's a tertiary prevention, and really that could be called treatment prevention. And what it is, it prevents deterioration or reduces complications after a disease has already been identified. So high cholesterol is a good example. A lot of people may have high cholesterol and they're taking a statin medication. So if you have high cholesterol, plaque is gathering in the arteries and the veins, and you don't want that there because you could end up with a complete blockage and get a heart attack or a stroke. So you want to take care of it, and you want to get that cholesterol reduced, so the doctor might put you on a statin, and that will prevent further damage. So there's also drugs that people take after they've already had a heart attack, and these drugs are to prevent further attacks or further damage to the heart. And this kind of treatment maybe will focus on months or years, not days or hours. So we're not talking about acute things that are happening. Like if you have chest pain, you go to the hospital and you're being treated with IVs and different things, we're looking at days and hours. Eventually you come off those drugs and you go on to maintenance drugs that will prevent further damage after you've already had a condition or a disease that has been identified. I'm going to talk a little bit about cardiovascular disease because it is one of the #1 killers of both men and women. Patients aged 20 and over should undergo cardiovascular risk assessment every 3 to 5 years. And basically what that does is it tells you what your risk is of having a heart attack. And that risk assessment will include your family history. If you had a brother or an uncle or your father or your mother with that had cardiovascular disease, that had some kind of heart disease that they were taking medication for. It doesn't necessarily just mean if they had a heart attack, but obviously that would be the concern. They may have had angina, they may have had heart spasms, anything like that, and that all goes to your risk for having a heart attack. The major risk factor are actually things that are modifiable or things you can change. Diet. You can change your diet to include more fruits and vegetables, less processed foods, less carbohydrate, less fats, food that doesn't have a label. Food like this, what's here in the picture, apples, tomatoes, bananas, broccoli, there's a sweet potato there. And you know the foods I'm talking about. That produce that doesn't need a label because it's real food. Smoking, here is the second one. If you're a smoker, please get whatever help you need to get to stop smoking. There's a lot of smoking cessation programs. A lot of them are affiliated with the neighboring, these were in Oakland, so the neighboring hospitals in the area, all over the smoking cessation programs everywhere, and they're all free, and you won't be the only one there. There'll be quite a lot of people there, and it's good to get support from other people that are going through what you're going through. High blood pressure, big trigger for both stroke and heart attack. If you have high blood pressure, you will know that from when you go to your doctor's visit. And if your blood pressure is high going into the doctor's office, they usually will take it again later. They won't go by just, you've never had blood pressure. People are nervous going in, they take it as soon as they go in there. The blood pressure is up, they'll wait a while, let you get through the visit and then check it again later. It takes a while for your and other symptoms of high blood pressure before somebody is going to diagnose you as having high blood pressure. Headaches that isn't your eyes, that would be another indication. The doctor and the staff there at the primary care doctor's office will ask you other questions relating to high blood pressure. So if your blood pressure, you have a machine and it's up high, that it's not going, it needs to be up for more than one time. Our blood pressure varies throughout the day. High cholesterol, again, a statin would be, these are all things that can be changed. The high blood pressure can be controlled. High cholesterol can be reduced with medication. Diet, you're responsible for your own diet. You just eat a healthy diet. If you smoke, stop smoking. Smoking, heart disease, stroke, lung cancer, other cancers that they don't know what it's, that they don't actually say smoking is directly related to this, but it is. They're toxins that you're breathing into your body. COPD, emphysema, all directly related to smoking. And even if you've been a past smoker, some people were smokers, they've been off cigarettes for a while, but they may have already sustained lung damage and got COPD, the chronic obstructive airways disease, or emphysema. Obesity, lose weight. Again, there are other weight programs out there. Illinois Department of Public Health have a lot of programs that they have on their website. Your doctor, again, your primary care doctor will be able to put you in the right direction to obtain help in all of these areas. But obesity, we talked a little bit about the bariatric surgery. It depends on what your BMI is, and your BMI can be calculated by using your weight, your current weight, and your height. Anything over 30 is obese. Anything between, well, for somebody who's around 5'6", say, anything over 30 or over is kind of obese. It is obese. Anything between kind of 25, 26 is overweight. So, and even if you go into the computer and you just put in, calculate my BMI, there's a calculator will come up and that'll calculate it for you. That is another big trigger for all kinds of conditions. Diabetes, insulin-resistant diabetes, heart disease, high blood pressure, stroke. And we saw in the recent pandemic with COVID, the one big trigger for people getting COVID, where COVID was, which would put them into the hospital with COVID. I know there was a lot of people got it, even people that were vaccinated. But the vaccination, remember, for COVID was telling us that if you're vaccinated, you're not going to die from COVID. But it never said that you wouldn't get COVID. It just meant you wouldn't die from COVID. Obesity was the one big trigger that was present in almost everybody that was hospitalized with COVID. Physical activity. If you have a sedentary lifestyle now, then begin to start to do some physical activity. You're getting your blood flow going, you're getting your heart rate going. When your heart rate is up during physical activity, you're exercising the muscle in your heart. So a lot of athletes, people that are athletes, have a slow pulse rate. They might have a pulse, less than 60. Normally, we're between 60 and 80. People that are athletes, people that do a lot of physical activity, people that are runners, that are very fit physically, will have a low heart rate, lower than the 60 to 80, maybe around the 50 and above. And the reason that they have a lower heart rate is because the muscle in their heart is very strong. So when that muscle is pumping, they get more out of one pump than somebody else is getting out of, 60 to 80 or 60 to 80 pumps, right? They're getting more force and blood going around the body, so they don't need to have as many beats to do that as somebody else would. Now, it's when you're doing that physical activity, you're walking, you're on a bicycle, you don't need to be running to achieve what we're looking at. But you're exercising your heart. You're exercising, the blood is going around your body. It's feeding all your organs. I have mentioned this before in other talks. Physical activity, depending on your age and depending on what conditions you already have, go to your primary care doctor and have them give you a physical activity, how would you say, a kind of say, yes, it's okay for you to do these physical activities. So just kind of get screened by the primary care doctor before you go into physical activity, having not done something for a long time. The other thing is start off slowly, walk, so, you know, at your own pace, because you have to build up endurance, you have to build up conditioning, and you want to do it on time rather than on miles. You want to say, I can walk for 15 minutes, or I can walk for 5 minutes, 7 minutes, 10 minutes. Eventually you'll build up to 30 minutes a day for up to 5 days a week. They recommend about 150 minutes a week of exercise. So, and it may be on a bicycle, and you'll build up, you'll condition yourself, and you'll build up slowly. Then we have diabetes. Diabetes is, again, a trigger for heart disease, kidney disease, vascular disease. It needs to be controlled, but you also need to be incorporating physical activity, good diet. It's more than just monitoring your sugar. We have insulin-resistant diabetes, which seems to be more prevalent now. Insulin-resistant diabetes and diabetes mellitus are different. They come from different places. The one where people need insulin injections, that's coming from a different place than insulin resistance. Insulin resistance is a result of, or a consequence of poor diet and obesity, ongoing obesity, and being overweight and eating too many carbohydrates, where your body becomes resistant to the insulin that you are producing. People that have the type 1 diabetes have, that's type 2, insulin resistance is type 2 diabetes. Type 1 diabetes, those people are not producing insulin in their pancreas to begin with, and that's why they have to have injections. General cancer prevention, avoid tobacco use, lose weight if you're overweight, be physically active, eat diet rich in fruits, vegetables, whole grains, low in saturated fat, trans fat. That's basically a healthy diet. Limit your alcohol consumption and avoid excess sun exposure. It's very important to make sure that you're not getting too much sun exposure. You're putting on sunscreen. This will help you with skin cancer. And everybody should be wearing sunscreen at least a 30, if not more. If you have very fair skin like I have, from Ireland, I put a 50 on. But not everybody has fair skin, but that doesn't mean that you don't need to wear sunscreen. You still need to wear sunscreen. African Americans especially have to wear sunscreen. Just because you have a darker skin color does not mean that you're not going to get exposed to the sun in a negative way. You can still get skin cancer. Older adults. So the treatment goals for older adults and the older adults, like the 85 and over, or we have 65 and over, and then we have 85 and over. The goals of treatment are to preserve the function they already have and to maintain the quality of life that they have, okay? Older adults will develop a healthy, if they develop a healthy lifestyle, this will lower their risk of disability. They will have less falls. They'll have less risk of heart disease, blood pressure, diabetes, all of those, if they can develop that healthy lifestyle, which also includes preventative care and those visits to the doctor, whether you're sick or not, regular doctor visits. We said 50 and over is at least yearly. Some people may need to go more often if you have various conditions or diseases for follow-up, for labs and things like that. But remember, it's all towards prevention to keep you at optimum function and to be able to enjoy a good quality of life. Physical exercise, we talked about the aerobics. The other thing that's very good and preventative again is weights. I'm not necessarily, we're not talking about heavy weights or lifting all kinds of things at the gym, even small 2-pound dumbbells that you can move your arms, you know, your shoulders, do it above your head, and the doctor can give you advice on that as well. Flexibility and stretching. So just regular stretches that will stretch your muscles, stretching so that you're not, it's all towards injury prevention and balance. Tai Chi, yoga, those kind of things. We have here a lot of yoga for health DVDs here at the library. It's good for, this is all towards prevention. It improves balance and it saves you money. All of this prevention saves you an awful lot of money with co-pays and tests and things the insurance won't cover that you still need to have. So in the long run, it's cost saving. Again, quit smoking and no more than 7 alcoholic drinks per week. Oh, here I have, and I think the person here at the library is going to be, we have them here on the table, but she's going to be able to email them out to you. Mm-hmm. So it is the vaccines for the different age groups, 19 to 26, 27 through 49 years of age, 50 through 64 years of age, and then greater than 65. These are the vaccinations that are recommended by the US Preventative Task Force. There is a website out there, it's the US Preventative Task Force, and it's all towards preventing people getting sick and getting diseases, because it's very costly, as we all know, when you do get sick. We have influenza, 1 dose annually for everybody. Tetanus, again, the tetanus, diphtheria, and pertussis, 1 dose for everybody. Measles, mumps, and rubella, any of you that have had children knows that 1 or 2 doses, depending on the indication of born in 1957 or later. You're not going to be get MMR vaccine at over 65. Zoster, so this is the shingles vaccine. So 2 doses for immunocompromising conditions. Immunocompromised conditions are the autoimmune diseases, or people that are going into chemotherapy treatment, that are going to be immunocompromised. And for people 50 through 64 and over 65, 2 doses. If you have had chickenpox, you can get shingles later in life.
They're very painful.
And we have heard of people getting shingles, and shingles itself is very painful. Shingles can be treated and it will go away. However, 6 months to a year after having shingles, and this doesn't happen to everybody, but you can get a post-herpetic neuralgia is what they call it. And it's after having shingles, you can get a neuralgia, which is a nerve pain. And that nerve pain is excruciating. It's very, very painful, and it's very hard to treat. And it may or may not go away. And that's why people, especially over 50-year-olds that have had chickenpox, need to get that shingles vaccine. The shingles can be treated, but it's likely that you could get this post-herpetic neuralgia, which is very painful, and it will not go away.
Painful where? Throughout the whole body?
Painful along where you have the shingles. The neuralgia is a pain that's along a nerve ending, a nerve line. And that's why it's very hard to treat, and it's very hard to get rid of the pain. Some people get, you hear people getting neuralgia in their face, or they might have a neuralgia type of pain, and it's quite difficult to treat, meaning it's difficult to get rid of that pain. Now, there are other pain medications, and we all know about them, but they won't it's hard to get rid of the neuralgia pain. The HPV vaccine, again, the doses 19 to 26-year-olds and 27 to 49-year-olds. Pneumococcal, that I talked about, the pneumonia vaccine, that can be given from 19 to 64, but definitely 65 years and older should have the pneumo 15 vaccine, and followed by the pneumo 23. It's just different variants of pneumonia. Pneumonia vaccine will stop you getting pneumonia. Pneumonia can be very debilitating. We heard people calling COVID pneumonia. I don't know if that was quite pneumonia as much as it was COVID, but it was definitely, the COVID was affecting their lungs. Then we have hepatitis A and B, meningococcal. Meningococcal, there's different letters, there's so many letters for the different variants now, and the influenza type B. Usually it's one dose, but you can have 1 to 3 doses depending on why you're getting it. And they're just the recommended vaccines from the United States Preventative Healthcare Task Force, and the CDC recommends these vaccines. This is just the second slide, and if you do want it, Megan can send it out. It is when you should get a vaccine and when you shouldn't. So if you're pregnant or you're immunocompromised, including the HIV infection, the influenza, the live vaccine of influenza is contraindicated. You should not receive it. And precautions need to be put in place, meaning precaution just means that if you have end-stage renal disease, or if you're on dialysis, and here it says heart or lung disease, or an alcoholism, or a chronic liver disease, if you're going to get it, the doctor will be you'll stay after you received it. If you have any complaints later or any reaction to it, you need to let your doctor know. It can be given, but under caution. And then all healthcare personnel get the live flu vaccine, and men who have sex with men get the live flu vaccine one dose every year. What other one? MMR in pregnancy is contraindicated, and in immunocompromised patients, excluding HIV. The varicella, that's the chickenpox vaccine. Again, when it's, when you shouldn't be getting it. So like if you're pregnant, then don't get it when you're pregnant. You can get it when you're not pregnant. What other ones? There isn't that many, but there are some that you just have to get them with caution. Yeah, hepatitis A, hepatitis B, those vaccines, the hepatitis B, 2, 3, and often 4 doses for people that are immunocompromised, that have end-stage renal disease, heart or lung disease, alcoholism, and the list is all there. I don't need to read out anymore. The one that's more important is the one before that, of the age groups that you should be getting certain vaccinations out. all towards preventing disease, preventing you getting sick. It's a lot cheaper on you and on the health service, but on the individual to not get sick, use preventative measures to not get sick than it is when you're sick to try and get rid of it. And I think that's it.
Very good.
Okay.
Thank you.
Oh, you're welcome. I'll give you this here. You can